Hi there, everybody. It's Dr. Steve, and here is your Understanding Your Pain about ankle sprains. And in part one, we just got things moving. We started to go through some of those initial injury acronyms, RICE and MEAT, to do some rest, ice, compression, elevation, some movement, exercise, analgesics, and therapy, getting things moving. We did a little toe tissue pickup to get the foot going. And then we did some squats in a bunch of different positions to start to get the ankle joint going. So one of the things that often happens is we develop this fear of stepping and shifting weight onto that leg because sometimes it hurts. Sometimes it's just the fear, and when you actually test it out, it's like, oh, wait, that actually went better than I expected. So getting the body used to stepping in different directions and shifting some weight onto that leg is going to be helpful. So we're going to go into that, but we're going to pick some directions that are going to be easier on an ankle sprain. So this is focused on an ankle sprain where typically it's the outside ankle ligaments that get sprained. And so we're going to go in some directions with these steps that are going to be a little bit easier on that part, but still getting you and your body used to that shifting weight onto the stepping leg. So we're going to start with a going forward step, but what I want to have you do is we're going to actually turn the toes out. So what ends up happening is this puts just a little bit more emphasis on those inner ligaments of the ankle, and it puts a little bit less emphasis on those outer ligaments, so they don't have to struggle so hard. We're doing some motions, we're doing some weight shifting, but we're doing it in a direction to try not to make it hurt so much. So a little forward lunge with the toes turning out. We'll do that on both feet. So there's a benefit to the stationary leg getting some work as it's the support leg when the other foot is going someplace in space. So our first step is this anterior step, but turning the toes out. Next, we're going to do one that we call opposite side lateral. And so there's this piece of tape here that's kind of going side to side. And so this one is where I'm stepping across the body. I'm still going in this side to side motion, but I'm going to the opposite side. So my right foot is stepping to the left. We're going to keep our toes pointed forward for this. And again, this direction tends to put a little more emphasis on that inner part of the ankle joint, and the outer part of the ankle joint is on a little bit more slack. We're just not loading it as much. But here, we're doing this step across the body. Most of the time, this one will be surprisingly comfortable. And then we'll do the other foot, opposite side, lateral lunge or step. We're shifting weight onto that stepping leg. We're keeping the toes pointed forward for the time being. And these, again, are directions that I am expecting will be more comfortable to step in if your ankle is sprained. So now we have a third direction, and this is going to be a rotation. In this one, we're going to do the same side rotation, meaning the foot is going to step out and back. And this again is putting the feet into positions where we're not putting as much load, as much strain on those outer ligaments. And so very often this is a direction that is comfortable to be able to do when your ankle is sore and angry and swollen. But where we're stepping back, turning the toes out, we'll do same thing other side. And the idea is that we want to remind the body about shifting weight, about accepting the weight, loading into that leg, exploding back off of it. And we're picking directions that I'm expecting will be more comfortable. But ultimately, we got to listen to your body because it will give us the most information. So if you or anybody that you know are struggling with an ankle sprain, don't sit home and suffer, but come on in so that we can get you moving and back into having fun, moving with confidence, and not ending up with a dorsiflexion restriction in your ankle that causes other problems down the road. So be sure to tune in to part 3 where we're going to go a little bit more specific to kind of minimize that dorsiflexion restriction that happens. But these will get you moving and keep you moving. So until next time, keep moving, everybody.